Today, we are going to take a look at a bodyviz brain builder about the muscular system, and then walk through a case study example. Muscles do a lot more than help you show off at the gym. They pump your blood, allow you to blink, breathe, swallow, and more. Muscle tissue is one of the 4 fundamental types of tissue, and every muscle in the body fits one of 3 categories: skeletal, smooth, and cardiac. Of the types of muscle tissue, only skeletal muscle is controlled voluntarily by conscious effort, thanks to the somatic nervous system. Your heart and organs function on their own, regulated by the autonomic nervous system. While each classification of muscle has distinct characteristics, all muscles are organs composed of specialized cells that use chemical energy from nutrients to contract. Skeletal muscle is organized into layers, from the whole muscle down to the smallest filaments. The muscle itself is wrapped in connective tissue called fascia. Inside, bundles of muscle cells called fascicles are grouped, with each one wrapped in paramecium. Each fascicle contains individual muscle cells, called muscle fibers, wrapped in endomecium. And inside each fiber, repeating units of sarcomeres contain filaments, actin and myosin, responsible for contraction. Muscle contraction begins at the neuromuscular junction, where a motor neuron releases acetylcholine. This creates an electrical signal that travels through the muscle fiber and causes calcium to be released from the sarcoplasmic reticulum into the cytoplasm. Calcium allows actin and myosin to bind together and pull. When millions of sarcomeres shorten at the same time, the entire muscle contracts and movement occurs. Cardiac muscle has the same core contractile machinery as skeletal muscle, with sarcomeres made of actin and myosin, which are triggered by calcium ions. If you look at a cardiac muscle cell under a microscope, you'd see the same striated banding pattern for exactly that reason. Though, unlike the long, parallel fibers of skeletal muscle, cardiac cells are branched, connecting to neighboring cells in multiple directions. But cardiac muscle has a unique job, beating in a coordinated, steady rhythm to pump blood through the entire body without ever stopping. Intercalated discs make this possible. These specialized junctions connect cardiac muscle cells and allow electrical signals to pass rapidly from cell to cell, so the entire heart contracts as one. One important note is that these electrical signals are not from the nervous system. Instead, the heart generates its own signals through the sinoatrial node, a small cluster of self-exciting cells that acts as the heart's natural pacemaker. Think of the conduction system of the heart as one closed electrical loop, and think of the intercalated discs as power strips, making sure everything is turned on and off at the same time and everything is working in unison. Smooth muscle, by contrast, has no striations, hence the name. Its fibers are tapered and have elongated nuclei, allowing them to shorten and generate tension even after being stretched. Unlike skeletal muscle, smooth muscle function does not require conscious effort. Today, we will focus on skeletal and cardiac muscle, but note that smooth muscle is critical to your digestive system, organs, and blood vessels, which all expand and contract. Hypertrophy simply means an increase in cell size. When you train a muscle consistently, the fibers experience small amounts of stress and damage, and the body responds by rebuilding them slightly larger and stronger. This is typically a normal, healthy adaptation. However, hypertrophy can occur in any muscle tissue, including cardiac muscle. Depending on the cause, muscle growth isn't always a good thing. One dangerous result of hypertrophy is hypertrophic cardiomyopathy, or HCM, which is a condition where the heart thickens abnormally. It most commonly affects the left ventricle, the chamber responsible for pumping oxygenated blood out to the body. As the ventricular wall thickens, the chamber becomes stiffer and has less room to fill with blood during relaxation. Less blood filling the ventricle means less blood being pumped to the rest of the body. HCM is one of the leading causes of sudden cardiac death in young athletes, which is why recognizing the warning signs can be so important. Because hypertrophic cardiomyopathy causes a reduction in oxygenated blood reaching the body, the most common symptoms of HCM are all associated with low oxygen levels. Symptoms include shortness of breath, dizziness, fainting, and an irregular heartbeat. Diagnosing HCM usually starts with the patient's medical and family history, since genetics play a significant role. From there, doctors may use an echocardiogram, an ultrasound of the heart, to look for thickening of the ventricle walls. Blood tests, X-rays, and MRIs can all provide additional information. Treatment depends on the severity of the condition, but the goal is always the same: help the heart muscle relax and pump more efficiently. Calcium channel blockers work by limiting how much calcium enters the heart muscle cells. Less calcium means less contraction force, which helps the thickened heart muscle relax. Beta blockers work similarly, slowing the heart rate and reducing the effort of each beat. In severe cases, a small device called an implantable cardioverter defibrillator, or ICD, can be placed in the chest to monitor heart rhythm and deliver a corrective shock if a dangerous irregularity occurs. Lifestyle changes can also make a difference. Limiting intense exercise, reducing salt intake, and regular monitoring are all part of living well with HCM. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 17, sex female. Chief complaints: shortness of breath and dizziness during soccer practice. You invite the patient into your office for an examination. You are a cardiologist at a sports medicine clinic. Your patient's pediatrician referred her to you after she reported recurring dizziness and shortness of breath during soccer practice. During intake, you note a family history of heart disease. You order an echocardiogram. The imaging confirms thickening of the left ventricular wall and shows that the mitral valve is not closing properly, allowing a small amount of blood to flow backward into the chamber. You also run a genetic test, which returns a result consistent with inherited hypertrophic cardiomyopathy. You meet with the patient and her parents to discuss the diagnosis. You explain that her heart muscle has thickened abnormally, reducing the left ventricle's ability to fill and pump effectively, which is why she feels short of breath and dizzy when her body demands more oxygenated blood during exercise. You advise her to stop competitive play for now and begin a course of beta blockers to reduce the strain on her heart with each beat. Depending on how her heart responds to treatment, a return to play may be possible down the line, but that decision will be made carefully based on follow-up testing and specialist guidance. This has been a classic example of hypertrophic cardiomyopathy. Thank you for watching this Brain Builder video. Please like and subscribe to our YouTube channel, and if you are new to BodyViz, check out our other anatomy resources and schedule a demo today at bodyviz.com.